So it makes business sense. Another poll out today finds a majority of Americans want Obamacare repealed. That number has been steady for years now. But this latest change from the White House is just another example of two things. One, that the law is fatally flawed. And two, that Obama will do anything to keep this baby alive. Joining me now from our bureau in Washington, D.C., Legislative Director at the National Center for Policy Analysis, Brian Williams. Brian, when I think of Obamacare now, unfortunately, I have this picture in my head, black and white film, these cops running around, silent film, Keystone cops with their batons, chasing the bad guy and never getting anywhere. Unfortunately, we have reality here, and the reality is millions and millions of Americans are being negatively affected by these Keystone cops.
Well, you're absolutely right, of course, Graham. Thanks for having me on. I wish I could bring clarity and some understanding to this, but I really can't. I'm just as confused as the rest of us. Remember back to before the Affordable Care Act, we had a system. It was imperfect and it had its problems, but it covered about 85% of people, and people kind of made it work. But here we have Obamacare just blew everything up. He's totally destroyed the individual mandate. So at this point, repealing Obamacare will not bring us back to what we used to have. That has largely been destroyed. What we need to do now is examine exactly what the administration is trying to do and try to figure out how to go forward. If you look at what happened yesterday, that was a tacit admission that the Affordable Care Act is causing hardship on people. Let me just review really quickly what he did. People whose coverage, they had coverage before, but because the coverage did not meet the demands and the regulations of Obamacare, the rules required that those plans be canceled, that they be eliminated. And so people are now left without health insurance, and now they go onto the exchange and find out that the coverage is much more expensive than they thought it would be. And so the delay that was announced yesterday allows those people to be exempt from the individual mandate for 1 year, just the 1 year. But it's a tacit admission that the hardship that Obamacare is causing is really going to probably increase the number of uninsured relative to what it used to be.
Yeah.
And what about the people that were uninsured before Obamacare? They don't get an exemption.
Right.
Now, the House Republicans have passed a bill over in the House of Representatives giving a blanket delay, a 1-year delay for everybody. In fact, that was part of the negotiation during the October. Remember the negotiations before the government shutdown.
Right.
On the table was an offer to fund the government in exchange for having a 1-year delay in Obamacare, but of course that wasn't.
Of course,
that wasn't
and Brian,
taken up by the Democrats.
I would add to your assessment of this edict was in reaction to the previous edict, which was the pleading with the insurance companies to uncancel the canceled insurance plans, and it made absolutely no sense if you have any business acumen at all, because insurance companies program things 2-3 years down the road. You can't just suddenly undo what you've been planning for 2 or 3 years prior. It shows to me what absolute economic illiterate the President of the United States is and everybody around him to go out there and suggest that a company undo what they've done.
That's exactly right. You've hit the nail on the head. The insurance companies need to look ahead, and they need to understand and assess what kind of exposure they will have. They need to look at who's healthy, who's not healthy, who has, how old people are, and they assess that entire risk in its totality, and that's how they price their product. But if they don't have that information, and if the President of the United States, through a press conference or through these evening announcements, if he decides, well, this population is exempt and this population has a 1-year delay and so forth, it just throws the insurance companies are in utter chaos. They do not know who their customers are going to be, how much exposure they have, how much risk they have. It's going to be impossible for them to price their product.
Not to mention, it's confusing to me. It's confusing to you. It's confusing to tens of millions of Americans who are trying to make sense of what is completely nonsensical. But you look at the individual mandate as an example. This is going to be an absolute budget buster for millions of American families. They're going to have to make hard choices, pay for Obamacare and not pay for something else.
Right. Yeah, even if they could get the individual mandate to work. Let's just assume for just a minute that the individual mandate would work. If it did work, what the individual mandate does is it requires families to purchase a product, health insurance, whose cost is growing at twice the rate of their salary, of their wages. And so over time, healthcare is going to crowd out groceries, rent, other things that these families are trying to buy. And that's if they could get the individual mandate to work. So it creates a strong incentive for families to find a way out of that mandate. Now, there is a penalty if you choose not to be insured. There's a $95 penalty or 1% of income, and a lot of families may, if you're young and you're healthy and you haven't gone to the doctor a lot recently, that's an attractive alternative. You would just pay the penalty and only get insured if you got sick. But
right.
If you wait until you're sick to get insured, that's another that will cause tremendous insecurity over in the insurance market. They will not know how to price that. It's like waiting for your house to catch on fire before you go buy fire insurance. That's just not going to work.
Right. It's not insurance. It's crazy. Brian, I'm out of time. Please come back. We'll chat about this more. I have lots more to talk to you about. Thanks for coming in.